In this video, we'll discuss pathology of delirium and laboratory and diagnostic evaluation of delirium. So what's delirium? Delirium is an acute impairment of cerebral function that causes acute confusional state, clouding of consciousness, and decline in cognition. So impairment of cerebral function, confusional state, clouding of consciousness, and decline in cognition. What about decline in cognition? Decline in cognition fluctuates over hours or days, but may last for weeks and months or longer. Fluctuating level of consciousness ranges from hyperarousal to lethargy to coma. Delirium may be the only manifestation of life-threatening disorder in elderly. What's the hallmark of delirium? Hallmark of delirium appears to have a diffuse localization in the brainstem, thalamus, prefrontal cortex, and parietal lobe. What are the EEG findings in delirium? EEG shows symmetric slowing supporting diffuse cerebral dysfunction. However, postictal confusion can also cause delirium, and its diagnosis is also done by EEG. What are the most common lesion sites that cause delirium? Lesions of right parietal and medial dorsal thalamus are the most common site which cause delirium. In most cases, delirium results in disturbances in cortical and subcortical regions. Focal lesions like focal ischemic stroke or mass lesions rarely cause delirium. So focal mass lesion like ischemic stroke or mass lesions, they rarely cause delirium. However, if there are decreased cerebral reserves, then a new focal stroke or hemorrhage causes confusion in these patients. Extensive cerebrovascular and neurodegenerative disease cause delirium. Multifocal myoclonus or hysterexis usually indicate a metabolic or toxic etiology of delirium. CNS infections, meningitis, encephalitis, and abscesses are less common etiologies of delirium. So CNS infection and focal ischemic attack or mass lesions, they are less common causes of delirium. Systemic infections, UTI, pneumonia, skin infections, cellulitis, and frank sepsis also cause delirium. So what's the cause of delirium in heart failure, septic shock, dehydration, anemia, and other systemic conditions? Cerebrovascular etiologies in these conditions are usually due to global hypoperfusion or systemic hypotension. Deficiency of acetylcholine can also precipitate delirium. What's pathogenic? Consult. Very high dose of anticholinergics can cause delirium in young patients. On minor insults, delirium developing in predisposed individual is widely accepted pathogenic construct. If a healthy individual with no known history of cognitive illness on hospitalization or elective surgery suffers delirium, then an unrecognized underlying neurological illness such as neurodegenerative disease, multiple previous strokes, diffuse cerebral cause should be considered. Laboratory and diagnostic evaluation in delirium. Routine testing, CBC, ESR, X-ray chest and urine DR, and blood and urine culture, LFT, and renal function test. And in young patients, serum and urine screening for drug and toxicology. What about the brain imaging in delirium? Brain imaging in delirium is often unhelpful, but it's helpful in excluding structural brain damages. CT scan can identify large masses and hemorrhages. MRI identifies most acute ischemic strokes, gives clues to possible inflammatory, degenerative, and neoplastic condition. This makes MRI a test of choice. So MRI is a test of choice to exclude all these conditions: ischemic strokes, inflammatory, degenerative, and neoplastic conditions. What are the findings in LP? When LP is done? LP is done immediately after neuroimaging in all patients with suspected CNS infections. So LP after neuroimaging in suspected patients with CNS sinus infection. LP identifies inflammatory and neoplastic conditions. It can also identify CSF hepatic encephalopathy through elevated CSF glutamate level. So in hepatic encephalopathy, in LP glutamine levels are raised. EEG is helpful for convulsive or non-convulsive seizures related etiologies like CJD, Creutzfeldt-Jakob disease. There are repeated bursts of diffuse high voltage sharp waves, and in bizarre behavior, EEG shows symmetric slowings supporting diffuse cerebral dysfunction.